So I had a patient with post-tonsillectomy bleed. This was 54-year-old lady who presented with bleeding. After her meal, she vomited and there was some blood collected in a bowl. So how common is post-tonsillectomy bleed and what should we do when there is post-tonsillectomy bleed? So number one thing is that post-tonsillectomy bleed is common and irrespective of whatever method you use, cold steel or coblation or bipolar laser, the chances of the bleed are almost similar. Coblation is basically it is intracapsular dissection and it is tonsillectomy. So any remnant tissue which is remaining, that can cause bleeding as well. Anyway, whenever the patient comes in, what are the few things they need to do? It's an emergency like any other bleeding, but this is more because the airway can be compromised. The patient can aspirate. The blood loss is almost always like around 300 to 400 ml. And number one thing to do is check the vitals. If the patient is tachycardic, is the patient having low blood pressure? Meanwhile, you're prepping up the theater. What you should do is that you can start the patient on tranexamic acid. That is number one. Or the other thing that you can do is start on antibiotic, because many times it's the infective slough also that can cause. And make sure that the theater is ready. We need an anesthetic and also a CBC, full blood count, is sent to know the hemoglobin, what is the loss, do we require a blood transfusion or not. Many people, they advise in many places that they can gargle with hydrogen peroxide. You mix hydrogen peroxide with saline and then you gargle. The thing with that is, in some places it is banned and not allowed because the effervescence, they say that it can cause embolism. The chances of that is 1 in a million, but that can happen. But that is one of the best things that you can do bedside. If there's nothing, just mix hydrogen peroxide with saline and ask them to gargle. Once you go in, you have to use tonsillectomy set. Use a long bipolar and ask your anesthetist to maintain normal blood pressure, not hypotensive, because we want to see where it's oozing from. At times it's even the muscle fragment, the tear, which is causing the bleed.